Neurology and neurosurgery share the tripartite mission of Tufts Medical Center, which is clinical excellence, research, and education. We feel strongly that trying to push the bounds of what we understand can lead to new treatments. We treat the entire nervous system, and that includes the brain and the spinal cord and the nerves and the muscles. That's the nervous system. So anything that can go wrong with any of those things is what comes to neurology. And it's been estimated that about half of all presentations to primary care doctors are potentially neurological problems.
Neurosurgery, of course, the brain and spine is heart and soul of everyone. And if the brain doesn't work properly, then serious problems occur. And so definitely our surgeries are complex and high stakes or high risk. I specialize in skull-based surgery, which is pathologies that involve the base of the brain, that involve the nerves coming out of the brain or the blood vessels going to the brain. So that involves operating through the nose with endoscopes or doing bigger open surgeries that go underneath the brain to reach different pathologies. We have neurosurgeons that specialize in brain tumors, in blood vessel problems to the brain, or what's called cerebrovascular surgery. Then we have multiple spine surgeons who take care of complex or minimally invasive spine problems. And then we cover pediatric neurosurgery as well. And we have people going blind, losing vision in one eye or another, and you take a tumor out and all of a sudden their vision is back. We have patients losing spinal cord function, losing their balance, having trouble walking. You operate on them and they come back in the clinic walking just fine. Because things are complex, we often work closely with neurology, particularly on things like stroke or blood vessel problems to the brain.
I don't think there's a department in this hospital that we are not involved in. We can't do it without them.
When you're trying to treat patients with complex conditions, people of different specialties come to that condition with a different perspective. You know, Dr. Malik in the endovascular arena working with the neurologist and Dr. Thaler, he's pulling clots out of blood vessels if we pick up the patient fast enough, restoring blood flow to the brain. And occasionally on the table, people start moving inside of their body right away. You get to see every day, concrete, absolute improvements right before your eyes.
The acute management of stroke has changed fundamentally in the last couple of years because it's been shown that not just intravenous medicines that neurologists historically have used, but endovascular or catheter-based removal of blood clots from patients who are having a stroke has a huge impact on their outcomes. We have a focus here on young stroke patients, which are a somewhat forgotten group. The understanding of young stroke patients has really been old stroke patients sort of applied to young people, and the diseases that lead to stroke in young people are very different. My colleague Lester Lung has started a stroke and young adults program, which focuses on the peculiarities of stroke in young people. Epilepsy historically has been managed with medicines. There have been major advances at identifying the location of the seizure focus, where seizures are starting in the brain, and for many of those patients, surgical removal of that little area of the brain can treat their seizures, if not cure them.
As an academic medical center, a big part of our mission is training the next generation of neurosurgeons. We focus a lot on resident education and make sure that the people we turn out are the highest in their profession and become leaders in the field.
We are training the neurologists of the future, both for here in Boston as well as other parts of the country or even other parts of the world.